Building a team to effectively implement a sustainable EBP should be supported by A. An organizational culture for EBP. B. Individuals who enjoy utilizing research findings. C. Leaders who are experienced at implementing EBP. D. Stakeholders who enjoy the benefits of EBP. What is an example of a problem-focused trigger for a change to clinical practice? A. HIPAA regulation to keep patient data secure from computer hackers. B. Medicaid and Medicare decision to collect patient satisfaction data. C. Increasing incidence of ventilator-associated pneumonia. D. Center for Disease Control and Prevention regulation to follow hand-washing guidelines. What is an example of a knowledge-focused trigger for a change to clinical practice? A. Persistent incidence of pressure sores among hospitalized elderly patients. B. Increases in complaints among patients with urinary retention. C. A Medicare-based refusal to reimburse for catheter-associated urinary tract infections care. D. High incidence of fall rates among patients on antihypertensive medications. Other than RCTs, what other type of research evidence should nurses consider for an EBP for clinical decisions? A. Qualitative. B. Expert opinions. C. Cost containment data. D. Traditional preferences. Which concepts have been responsible for revisions in the definitions of EBP? A. Evaluation of the process and structure of an EBP. B. Cost efficiency and quality of healthcare. C. Concerns about the patient and family desires. D. Promotion of outcomes related to hierarchy of evidence. The National Quality Forum (NQF) works to create measures that show how standards for prevention, screening, and managing health conditions are met. Which type of measure would help to assess the results of healthcare? A. Structural. B. Process. C. Outcome. D. Composite. Select two websites that would provide examples of translational research. A. CINAHL and Primary Research Studies. B. National Guideline Clearinghouse and the Best Practice Information Sheets of the JBI. C. PubMed and the Cochrane Library. D. PubMed and patient databases. Select the outcome for the following Pickett statement. Among patients with migraine headaches in the emergency room, how does the administration of an opioid medication compared with the administration of music therapy affect patient satisfaction at the time of discharge? A. Patients with migraine headaches. B. Administration of opioid medication. C. Administration of music therapy. D. Patient satisfaction. Identify which two entities recognize EBP in nursing as the best treatment plan for patient care. A. Cochrane Library and the National Guideline Clearinghouse. B. David Sackett and Florence Nightingale. C. Joint Commission and the American Nurses Credentialing Center. D. AHRQ and the National Quality Strategy. What is the overall goal of evidence-based practice for nurses? A. To improve patient outcomes with traditional nursing knowledge. B. To improve the effectiveness of processes and patient outcomes with the introduction of current knowledge into common care decisions. C. To explore how nursing expertise supports the best healthcare for patients. D. To introduce the knowledge gained from patient surveys into clinical decision-making. Complete the statement that best describes an evidence-based practice EBP. An EBP is based on evidence blank. A. And changes to practice over time. B. From multiple studies that agree with the clinician's expert opinion. C. From combinations of research studies and the patient's needs and desires. D. From a synthesis of studies and expert decisions that consider the patient's circumstances and values. Identify which concept within Sigma Theta Tau International's definition of EBP seems most sensitive to the nurse's role as patient advocates. A. The patient's values. B. The best available evidence. C. A conscientious use of the best evidence. D. Cost-effectiveness. Which type of evidence is considered the gold standard for practice decisions? A. Survey evidence from patients following discharge from the hospital. B. Responses from a patient during his or her history and physical assessment. C. Evidence from randomized clinical trial research studies. D. Evidence from the clinician's clinical experiences. Identify the professional role of the person who introduced the concept of using evidence as a basis for practice decisions. A. An American nurse. B. A British epidemiologist. C. One of the earliest male nurses. D. An Australian who started the Cochrane Library. What person or organization is generally credited with starting the movement toward evidence-based practice? A. Archie Cochrane. B. David Sackett. C. Cochrane Collaboration. D. Agency for Healthcare Quality and Research. Identify which topics are listed as research priorities among the members of the Oncology Nursing Society. Choose all that apply. A. Quality of life. B. Falls. C. Pain. D. Domestic violence. E. Quality assurance. As nurses first began to receive advanced educational preparation and became qualified to conduct research, many of their studies concerned blank. A. Nursing education. B. Characteristics of nurses. C. Nursing administration. D. Nursing care. All nurses should be able to blank. A. Identify researchable problems for nursing research studies. B. Explain the details of a medical research study to potential participants. C. Determine when most study findings are ready for use in nursing practice. D. Confidently critiques the majority of published nursing research studies. Describe the usual setting for research during a qualitative study. A. The setting is usually a remote place where the participant responds to a survey. B. Small numbers of participants usually share their information in a natural setting. C. Large numbers of participants respond to computer-based surveys from their homes. D. A proctor and quiet test setting is used to collect information. What type of research provides a statistical analysis of the relationships among variables? A. Quantitative research studies. B. Qualitative research studies. C. A tightly controlled study. D. A cost-effectiveness study.